Welcome back to The Factor Uncensored. People around the world have been dealing with a random outbreak of the West Nile virus. You remember that, right? Dr. Danish Ali with ArchPoint Pain Institute joins us to talk about the origin of the virus and what to do if you get infected. Dr. Ali, I remember when we started first hearing about the West Nile virus, the entire country was freaking out, and it's kind of like, we're blowing it off now, but it's still very deadly and it's still around us.
That's correct, Isaiah. What we've seen is a number of cases that have been significantly higher this year and this season so far, especially with the weather changes and the increase in the number of rainy days. That causes an increase in the number of mosquitoes. There's more pooling of the water in different places where there's a increase in the number of mosquitoes. And so because of that, we are now seeing a significantly elevated number of cases here in this Harris County. And I suspect there's a lot more that we are not seeing, or they're coming into the hospital because the symptoms often mimic the flu. Isaiah, you get nausea, vomiting, fever, chills, stomach pains, and just body aches. And those are all very similar to what we see with the flu. And so people often just chalk that up to the flu, and they'll, do some management symptomatically and take over-the-counter medications, and they may not go get tested because it is a blood test that you have to do oftentimes to get this diagnosed. And so we may be seeing not enough cases or not enough that are testing positive, and there may be more in the society that people are just chalking this up to the flu, and it may not be getting the number one treatment, and number two, getting tested for it.
Now, initially, I think there was a major concern for older folk, senior citizens getting West Nile virus. Is it worse for an aging individual to get it?
It is, Isaiah, and the reason why it is because those aging folks have other comorbidities. They may have lung issues like COPD or congestive heart failure or diabetes, those things that make it difficult for the body to recover after these viral illnesses. And so just like with COVID, we saw an increase in the number of folks that were hospitalized and even died because they had other comorbidities that they could not bounce back and they could not recover in time. And so we do see that, and we see that with the West Nile virus itself. 1 in 150 cases can be very fatal and can cause serious effects. And so that's why that's why it's so important to take those measures, Isaiah, to use those insect repellents to make sure that the water is not pooling in your area. And so do those small things, get that little zapper, and, get ready for those, just make sure that you can stay as much as possible, stay away from these mosquitoes that may be carrying this virus.
And of course, if you get it, it's treatable, but you need that blood test first to know that you have it. Otherwise, like you said, it looks like the flu.
Yeah, and Isaiah, the treatment is symptomatic management. There's no actual treatment for the virus itself per se, but the symptoms that you may get, like fever, chills, body aches, muscle aches, those are all things that can be treated with different medications. And so that's why it's important to get tested, more importantly, and to be on the right treatment and not just chalk this up to the flu. And that's what we're seeing right now.
All right, Dr. Danish Ali, ArchPoint Pain Institute, we appreciate your time tonight here on The Factor and your medical advice, sir. Thank you for joining us.
Thanks, Isaiah. Happy to be here.